Then I would welcome you to our next talk. It's nice to see you all back. Our next talk is about data privacy in e-health. And this is a very important topic because a lot of people want to assess this information, especially in emergency situations, but we believe that this information is highly sensitive and should be private. And in this setting, our next speaker, Ferreira, has not only done her PhD, but does active research. She is usually located in Porto, Portugal, at the university, but today she is here. So please give her a warm welcome.
Thank you. Hello, good morning to you all. It's a pleasure to be here sharing with you some of the research in this area. So today's talk is about securing the digital who's in healthcare, and we have many who's in healthcare, as you will see. So we'll talk about a bit some of them, and then I'll talk about the main challenges, especially related with healthcare, but also related with digital identities. And I'll talk about the Portuguese use case, give some examples, and I'll finish with a very brief discussion on AI, risk, privacy, trust that already the previous talk has mentioned some issues and challenges. So who's who in healthcare? Well, we all know the patients. Of course, we have many patients, unfortunately. And we know that we have many identifiable data about the patients. It is scattered over different institutions, private, public sector, and so on. But we also have many sensitive data. So it's not only personal identifiable data, but also healthcare identifiable data. And we need to make, and we also in Portugal, we have GDPR. So we need to control the way we process all this kind of data. And in GDPR, we have the special categories. So healthcare is one special category. So beyond all the usual controls, we'll still have more specific controls in order to protect healthcare data and identifiable data. So it is actually forbidden to use healthcare data to do profiling within this kind of legislation. So, but we know that cybersecurity in healthcare is about people's lives. It's about protecting their data in order to protect their lives, mental and physical integrity. But we need to create a balance between how much data we actually gather in order to identify the patient or the users of healthcare, and also what kind of regulations we need to abide to, we need to comply to. So that's really a tricky issue. But then we have also other rules. We have the patients, but we can also have health professionals. And health professionals, it's of many types. We can have doctors, physicians, nurses, technicians. We can have many different people with many different roles. We can have also administrative personnel, which manages most of the administrative issues and procedures. Then we can have what we call the IT people. So we have groups of people trying to make sure the infrastructures are there, the networks, communication, all the systems are working, also not only equipment, but also software. We have the researchers, people hopefully like me that try to improve some of the issues that are there, some of the challenges. We have students. So students are there after the third year, I think they have clinical years. They have to be in touch with the patients. They have to access patient data. So that's very relevant to them. And we also have other third parties. We know that we have many suppliers in healthcare of medical devices, of software, and we have even a small department can have many different software and equipment. So we have to manage all this, and all these need to access at some point information and data within the healthcare system. So this is a very complex ecosystem. We can have also public and private institutions. So for example, in Portugal, we have many private institutions growing up. So we have many private hospitals, and they have a lot of people going there, unfortunately. Then we can have still paper and electronic format of information. And all this can be scattered all over the country, sometimes even beyond the country. So everything may be all separated in different formats. It's not integrated in most of the times, and it can be redundant. We cannot find out about data quality and all this. So this is a generic view of the context. So regarding the challenges, we have many challenges in healthcare, as you probably know. So we have been having a lot of increase of attacks in healthcare, the healthcare institutions. This health record is very much sought of. So it is very valuable. It's the most valuable piece of data I would say, in the world. I risk to say that, because the next valuable data is the information about credit cards, bank accounts, and so on. So it's these 5 times, more or less, what it is a credit card information. So obviously, people want to steal it. People want to take advantage of it. And we have seen a lot of organized crime, organized people, criminals, performing these attacks, stealing the data. So the most common attacks are actually to steal data in order to sell it, to make the most money of it. And the most common attacks are also ransomware, as you have heard. So these are the most common attacks, and together with SQL injection, they attack the network servers and the email servers most of the time. So this is the main pathways for the attackers and the criminals to get to their data. But there are also other issues. In healthcare, we have diversity. We already talked about the users. We can have many different types of users, but we can also have many different types of technology, medical devices that are invasive, non-invasive, tracking personal data, monitoring biosignal from the patients. And all of this with a lack of interoperability. And also, these devices were not done mostly with security in view. They don't have security installed or integrated into it. So we don't know what will happen when they try to integrate, then they try to communicate. So it will be a cascading effect of problems and challenges and vulnerabilities that can come from there. And then obviously, how do we make access management to those types of devices? It's very difficult to have appropriate and dynamic access control policies for all the profiles we've seen that need to access information. And we have a very huge attack surface. You can have as well multiple devices, multiple physical sites. We have networks, the clouds, you name it. You know, we only need one vulnerability to be attacked, and we need to protect all of them. But then we also have no diversity. So I want to discuss with you this because it's a very complex ecosystem, but then we have a very small number of people, an homogeneous team of technicians, of IT people, of cybersecurity people, if we're lucky to have within the teams in healthcare, in order to develop and to make sure this works very well. So it's very difficult. Many times we don't have the necessary expertise. We cannot respond to the vulnerabilities, and it's very difficult to make this more closer to the users and the needs of the users. So in healthcare, I usually call it that we have a currency called lack. We have a lack of infrastructure, lack of resources, lack of expertise, and so on. Education from the part of all these myriad of users that we have. But also healthcare hasn't had time to catch up. So technology and cybersecurity, cyber attacks mainly have evolved a lot, and there is no base infrastructure for this to be taken upon. And patching is not enough. We are seeing that it won't be enough, and we are seeing that many healthcare institutions are being attacked. And all our patient data is going, we don't know where. And so we need to rebuild trust in this area. We need to make sure that users are well taken care of, because in the end, it's about their health and safety. So let's talk a little bit about then the Portuguese use cases. So in Portugal, you know, it's a small country, but we have various manners of accessing our health or managing our healthcare information. We have applications, we have mobile applications. We can also access web-based. Usually is to manage consultations, check exams, results, and so on. And we have an infrastructure that is based on our electronic ID. So every citizen in Portugal has an electronic identification. So we have had for more than 20 years now, but we have had ID, not electronic, before that. So every time someone is born in Portugal, they need to be attributed a specific ID number, and hopefully unique, obviously. And then we have this infrastructure set up in order to access services from the government. So tax services, and we also have healthcare, and we also have social security and all this. So it's a platform of an infrastructure of service that we can access via this type of technologies. So what is implemented is we have the ID smart card. We can access via digital mobile key and also unique health ID. So I'll show you about the EID. So this is the smart card we have in Portugal. So as I said, it's a smart card. So it is embedded personal data. So the name, the address, the date of birth. But there's also the unique ID. There's also the unique health ID and other unique IDs like Social Security ID and the taxpayer ID. But it has also integrated our digital certificates. And we also have the fingerprint assigned to it, and also have the face facial recognition. So every time we go renew, for example, the card, we need to take a new picture and we need to put our fingerprints of both hands. So when we need to access or authorize, let's say, to this platform, for example, the SNS, which is the Health National Service platform, we need to have the ID card. We need to have a smart card reader in order to read the card. Then we have an authentication PIN that we get when we register the card. We need to have a plugin. So this authentication .gov plugin in order to be able to use the card, to access the information of the card. So in order for someone that has already installed and done everything like with this, we have a two-factor authentication. So we have a smart card, something that we have. We need to put it in the smart card reader, and then it will ask for something that we know, which is the PIN number. So this is one way of doing it. This is the plugin of the authentication where you can see the information about our card. So we have the identity, the name, and so on. And then we also have the digital, we can digitally sign documents with our card using this plugin. So you can just have a PDF document, and this is legally binding in Portugal. You can even buy houses and stuff like that. And signing contracts is the same as a normal signature, a handmade signature. And we can also have information about our digital certificates, the validity, and our PIN numbers. We can change it here and so on. Then we have another way of doing this. So it's another option. It is called digital mobile key because we associate our ID number, unique ID number to the mobile. So we have a mobile, and then we can have this associated to the ID card. If you're not a Portuguese citizen, you can have some ID from your passport, something that identifies you uniquely, together with a PIN number. And then it's again a two-factor authentication. You need to provide a bit more information because you need to provide your mobile number and PIN, and then you get a unique token, so something that you'll have uniquely for each transaction via SMS, email. It depends on what you have defined. And in this case, I think it has been this month that is starting. Instead of the unique token, you can use fingerprint or the facial recognition within your mobile, if you have that service, obviously, in order to proceed with the second factor authentication. So instead of the unique token, you can just put your fingerprint, and that will serve as a two-factor authentication. Obviously, this is checked within the information that you have in your citizen card, in your ID card, which was already taken when you registered as a Portuguese citizen. And then you can have another option. If you don't want to use it, something simpler, so you don't want to use authentication plugin, you don't have a smart card reader, for example, and you're not used to these kind of things, then you have your unique health ID, so is usually also in the card. So you have a mobile number registered in the National Registry, and it needs to be there and authenticated there. And then it's again a two-factor authentication. You have a health ID, date of birth, and mobile number, so you need to provide more personal information when you try to access in order to compensate with all the rest. But then you get an SMS token, so it's something that you will have at the moment uniquely done. So there are obviously in these three ways advantages and disadvantages. So it is a two-factor authentication, so it's better than just login in password, I suppose. And then it is integrated within many other services, so it is good that you can access many different services, and you have many options. So you're not forced to use a smart card reader, you're not forced to have some app installed in your mobile, but still you have some disadvantages because it's centralized. Whenever your PIN is compromised, you forget your PIN, everything, you cannot access any of the services. And then it takes a lot of time. Well, at least it's not instantaneous to recover your PIN number again. You need to go to the place and ask for a PIN number back, and then they have to send you via post in a paper letter, registered in the post, and so on. So it takes longer for you to recover, so it's a more controlled process. And still with all these main types of interactions, I do feel it's still not inclusive because not many people have access to all these kind of things and may not be able, for example, people with disabilities and all the accessibility issues, and we all need to think about this. What other ways can we make it even more inclusive? So, and then we have the private hospitals. Okay, I'm not going to the detail of this, but okay, as my own experience in the private and public hospitals, you just need a login and password. You just register with your client ID, you choose a password, and then you can access all, you can manage your consultations, you can check your exam results, you can do everything you want. And then it's normal recovery, login, password for everything. And then just a little bit about the professional. You have the professional in healthcare. They need to access many different types of systems in order to manage a patient. I don't know if it's the same in Switzerland, but in Portugal we have different kinds of systems that we have been growing up. Some systems are to just collect clinical data. Some systems are to perform prescriptions and so on. They are separate. But most of them, as I understood, they are login and password. So obviously they are already inside the network, hopefully. Inside the institution in order to access, but still they don't have they don't have a two-factor authentication. The only system that has this is the electronic prescription. So we have set up in Portugal an electronic prescription system that the professional needs to access with the electronic ID. So it's a smart card and its PIN number in order to process this. This goes paperless to the pharmacy and goes also via SMS or via app to the patient, and they can just show it at the pharmacy and you get the prescription back. So this is very important because it goes beyond the infrastructures of the institution and also needs to be more protected in some way. But then we have other issues that go beyond the digital identities, because I know this in Portuguese, sorry, but it's just to show an example that last month we found a flaw within the general direction of healthcare's website. So it just needed to tweak a little with the URL, and then you could find a list of information, personal information about hundreds of patients. So in the end, it doesn't matter if you have all these good digital identities, two-factor authentication at the door, and then behind you don't have the required infrastructures and know-how to be able to protect it as a whole ecosystem as it should. So about digital identities in healthcare, going back to that, what we need, they need to be, besides all the challenges that I mentioned, which are a lot, they still need to deal in healthcare with emergency or unanticipated situations. So how to define this kind of digital identities in order to be able to understand this? So they need to be dynamic, definitely. They need to be adaptive to the system, to the type of access there it's being done in order to be more resilient. So we need to work with that to have it moment. Nothing is perfect, and in specific department of institution may be different in the other department. So you need to extend more the digital identities. They need to stay out of only the door. So they need to stop being just a doorkeeper. Once you open the door, there's still more there. There's the access control part. So they need to be user-centered or patient-centered, contest-centered, different departments, different locations, different types of accesses, and different types of goals. You may need to access something that is public information, but you still may need to access very high sensitive information in healthcare. So how do you adapt the access to that? So for me, that needs to be with risk management. So you need to connect digital identities with risk management. You need to see at that moment, for each interaction, for me, an interaction is unique. Even from the same user, from the same location. Every interaction is unique. It's done at a different moment in time, and possibly with a different location, different connection, different type of context. So how do you integrate all this? So for me, digital identities need to be bigger than just one size fits all. They need to be adaptive to the system at hand, to the access that is being done at that moment. So in order to try to bring digital identities to more dynamic in the way that you can have more emergency situations access, you can integrate into them break the glass. So what is break the glass? Break the glass is these policies that allow you to override the usual access control policies. So in this case, obviously, they need to be done within the controlled, justified environment, but you may need that a professional that is not there at the moment, the other professional needs to take over in order to access the data. And so it's availability beyond confidentiality. So we need to create this balance. We need to have more availability at certain times and more confidentiality at the others. So risk can help us with that. Will AI also help us with that? Well, I think that's the mechanisms we have now in order to try and do that. So by introducing risk, we can make digital identities creating a more balance between what is more private at the moment and what is less private at the moment, adapt to the need of each interaction. Having more fine-grained digital identities specific to each interaction. Sorry, I am repeating, but it's just, for me, each interaction, it has a risk associated to it. It has a risk, it has a context, it has a way of dealing with a specific access to a specific information. So maybe with AI, we can help to have this in a more controllable way, because we have privacy-enhanced technologies that we can also integrate there and make sure that is the best and more appropriate and more private access for that person at that time, at that decision of accessing information. So with this, in the end, for me, it's very important that we have the patient safety at hand. So if you make this more within the realm of the patient needs or the user needs, it is that it's more trustable. So it trusts more to use the systems. He has more options. He knows that it is integrated and closer to their needs. Hopefully, they will be more trustable to use the system. And then by doing that, they will be able to benefit from the technology that there. Because in healthcare, if you are, for example, a chronic disease patient, you may be able to monitor your healthcare throughout the years, unfortunately, days, months, years. In order to improve your health outcomes, it's good that you adhere to the technology regularly. So if you do that, and if you are in trust of the technology and the digital identities that are providing you that access, hopefully you'll have more and better health outcomes. So thank you so much. Thank you for being here and for your attention, and obrigada. Let me know if you want to discuss further.
Thank you for this great talk.